In my role as a vascular access specialist, I'm inspired by an amalgam of three things that bring about the best outcomes for the patient. Those three things are the development and implementation of best practices, the application and development of technology, and the pursuit of competence. Best practices are developed off the hard work of dedicated professionals. The passion of those clinicians researching and publishing in our specialty inspires me daily. These are clinicians that devour the current literature seeking to improve the care they provide and adding to the developing body of the knowledge we use to care for patients. Innovation inspires me. The companies and individuals that remain committed to doing things better every day through innovative methods and technology. Technologies like catheter material, for example, can alleviate major complications, or dressing materials that improve adherence. The pursuit of competency inspires me. We are all competent, but the tools and processes we use are ever changing, and we need better methods to ensure that we bridge gaps and stay up to date with the products and processes we use to care for our patients. There are continuous challenges in how to measure competency. When do we measure it? At what intervals? And how do we best support the clinician on an ongoing basis? Each of these are a domain unto themselves, but when they come together, we can be sure that the patient will benefit from optimal outcomes. I believe an underappreciated issue is our paradigm for vascular access devices across the care continuum. Inserters are not necessarily the people who are maintaining the line, and those maintaining the line are not necessarily the people who are infusing through it. Each of these folks comes at the device from a different perspective. I think often there's an urgency to deliver therapy, so we only focus on a device as a conduit. We lose sight of the importance of aseptic maintenance. We need to build and promote processes that help clinicians keep focused on key priorities in catheter care and maintenance. In today's healthcare environment, there is so much that pulls on a bedside clinician's time and focus. It is challenging to always keep all priorities in mind. This becomes even more difficult in the face of all of the needs of a given patient. We are all committed to the best therapeutic outcomes for the patient. The question is, how do we all effectively leverage that commitment? I believe one way we could leverage technology is using the mobile device in everyone's pocket. There should be micro-trainings pushed out daily that pertain to areas of focus or challenge for the institution. This could even be used if the clinician needs a refresh. Dressing changes are a relatively simple procedure, but they're high stakes. Catheter migration and infection are a perennial problem. If you're going to give staff a procedure, you have to provide practice. There's great promise in the use of augmented reality to enhance procedural practice. We have exciting times ahead. Aligning our paradigms so that we work, train, and care for the patient is critical. Everyone in healthcare has been overwhelmed with the COVID pandemic. Clinicians have demonstrated an extraordinary commitment during this crisis. I think we start every conversation this year with a heartfelt thank you to anyone who has had to work through this crisis. After, we need to reflect on our data. We know that infections spike during this time, and there are many variables that contribute to that spike. But can we draw some conclusions? It is always healthy to ask, what can we do better? I would also recommend looking at your catheter insertion program and asking questions like, who is inserting and how have they been trained? How are we ensuring their competence? What metrics are we using to measure ongoing performance? Do our policies reflect current standards and research? How can we leverage new technologies to assist? I know I mentioned a lot of questions. Each of those questions represents a project. I promise that anytime I've seen these questions addressed, it has yielded fruit. If you are an individual, Work to build confidence. If you're on a team, encourage the team to evaluate their practice together.